So pelvic floor exercises, or the pelvic floor muscle, is a hammock of muscle that sort of swings across the pelvis, and the idea of keeping your pelvic floor strong and doing pelvic floor exercises is to help prevent things like prolapse, things like urinary incontinence as you get older. So the pelvic floor exercises give the support. So if you've already got some symptoms of prolapse or some symptoms of incontinence, by doing good structured pelvic floor exercises, you can improve your symptoms, which means you may not then need any surgery for incontinence or for prolapse. So absolutely everybody can benefit from doing pelvic floor exercises. It's advised to do pelvic floor exercises when you're pregnant. It's particularly important to do them after you've had a baby, to do them postpartum. And if you carry on with the pelvic floor exercises as part of your general exercise routine along your whole life, then hopefully you're not storing up sort of problems that might then kick in around the menopause. So to do effective pelvic floor exercises, you can do them whether you're standing up, sitting down, lying down. So the whole idea is to be able to manage them in your daily life. To do an effective contraction, you need to gently squeeze around the back passage, as if you feel you're trying to gently stop passing wind, and feel you carry that squeeze forward to the front, so you then feel that you're squeezing to stop emptying your bladder. But what you're doing when you're doing both of those is you should feel a slight lifting feeling in the vagina, and that's how you do an effective contraction. And when you're doing your exercises, you need to do what are called fast contractions, where you would just squeeze up for a count of 1, relax for a count of 1, and do 10 of those a couple of times a day. And also strong contractions, where you squeeze and hold the muscle for as long as you're able, and that may initially only be able for like 4 or 5 seconds, but with proper education you can build that up. And again, you need to be doing those 2 or 3 times during the day. I think one of the commonest mistakes is breathing in and holding your breath when you're doing a pelvic floor contraction. A pelvic floor contraction is quite a subtle movement that's all about just sort of squeezing almost the muscles between your legs. So if you're pulling your tummy in, if you're holding your breath, all of the energy is going somewhere else, and that means you're not squeezing your pelvic floor muscle. And also some people inadvertently can actually be straining down and bearing down and not actually squeezing the muscles. So national guidelines, the National Institute for Care and Health Excellence, they suggest doing exercises at least 3 times a day and doing at least 8 contractions when you're doing the exercises. So we're very lucky at Benenden Hospital. There are 4 urogynae specialist nurses who are all fully trained to assess your prolapse symptoms, to assess your incontinence, give you all the conservative measures that you will need, like bladder retraining, pelvic floor muscle exercises, to hopefully avoid then having to go on and having any further treatment or any surgical intervention.